Jay, everyone. I'm here with Level Up RN. It's been a while since we talked about medical conditions that can mimic a stroke. So today we're going to go over the early signs of a heart attack. If you're new here, welcome. We would love for you to subscribe so you don't miss any of our medical education videos. When most people think of a heart attack, they think of someone clutching their chest and collapsing to the ground. While this is true in some cases, there are many other signs and symptoms that can indicate that you or someone you love is having a heart attack. And some of these early signs can be subtle or mistaken for something else. That's why it's important to learn them. The most common type of heart attack is called a myocardial infarction. This occurs when there's a blockage in the artery that supplies blood to the heart muscle. The medical term for this is coronary artery occlusion. The most common cause of this blockage is a coronary artery spasm. But did you know that there is also plaque buildup in the coronary artery that can cause this as well? You may be wondering what causes plaque buildup in the arteries. Well, things like high cholesterol, high blood pressure, smoking, and diabetes can all cause this. Plaque buildup is also known as atherosclerosis. Now that you know a little bit about what causes a heart attack, let's talk about those early signs. 1. Chest discomfort. This is the most common symptom of a heart attack. The discomfort is usually described as a pressure or squeezing sensation in the center of the chest. It often feels like an uncomfortable pressure that lasts for more than a few minutes. This pressure may come and go, or even radiate to your upper back or left shoulder. It's important to note that not all patients will experience this as a pressure. Some may feel more like a severe pain. 2. Shortness of breath. When the heart isn't getting enough oxygen-rich blood, you may feel very short of breath, especially if you're doing any type of activity. If you're already at rest, this shortness of breath could be a sign of congestive heart failure. 3. Lightheadedness or sudden dizziness. When the heart isn't pumping effectively, you may feel lightheaded or very dizzy. This is because the heart isn't supplying enough blood to the brain. 4. Nausea and vomit. These symptoms are commonly seen in patients who have a heart attack. Some people experience these symptoms before any other signs, and in some cases, nausea and vomiting may be the only symptoms present. 5. Sweating. You may experience heavy sweating along with the other symptoms we've discussed. So now that you know the early signs of a heart attack, let's talk about who is at risk for one. As I mentioned earlier, plaque buildup in the arteries is a common cause of heart attacks. This buildup occurs over time due to things such as high blood pressure, high cholesterol, and diabetes. Risk factors for a heart attack include being over the age of 65, having a family, history of heart disease, being a male or female who has gone through menopause, having a history of smoking, or being a current smoker. If you've made it to this point in the video, leave us a comment below. Let us know that you've learned something new today. We love to see your comments and questions. Also, please remember to subscribe so you never miss an upload. In the next video, we're going to talk about heart attack treatment. So stay tuned for that. We'll see you next time. Thank you for watching. Take care and stay healthy.